Lauren Culver, thanks for watching KX News. In tonight's top story, the fight against the opioid crisis continues. Now, back in January, we told you that the highest number of opioids prescribed in the state was in Burleigh County. Ever since the report, Sanford has taken a step back to reevaluate how many prescriptions they're writing and how they can reduce the number of patients taking narcotics. Renee Cooper joins us to explain why this has been a difficult process for patients.
Hi, Lauren. In 2016, the Centers for Disease Control released guidelines for prescribing opioids for chronic pain, and they were quickly picked up by hospitals and pain clinics nationwide. Hospitals in North Dakota, including Sanford and CHI St. Alexius, have looked to these for guidance.
In simple terms, these guidelines outline how to wean patients to reduce dosages or off of opioids.
We are essentially taking the stance and kind of stepping back and looking at all of our practices as a whole and saying, okay, well, are we in coordinates with everyone else around us?
But the CDC has actually gone back on the guidelines, saying they're being misinterpreted. This is a letter from the CDC director that says they don't endorse abrupt dose reductions.
And it's a matter of applying the right Band-Aid to allow me to have quality of life.
I heard from several patients who say, with little warning, they were told they would need to begin weaning immediately. Jamie Stewart, who has been on opioids for a chronic nervous system condition for 10 years, says he was told to comply or find another doctor. So he left.
Now I'm without managed care, and the managed care that I did have was force weaning me. So I'm at a point now where things are not as good as they were 2 months ago, let's put it that way.
He says now he really has to prioritize tasks each day and rest a lot in between.
Are the doctors doing the right thing in this case by giving him a couple months to wean off of 10 years worth of opioids?
You know, again, I don't know the patient personally, but really, again, it all depends on whether or not I would feel that that person would benefit from opioids. Really deciding, okay, you know, do you know how you would function without opioids? Because if you don't, I think it's worth at least trying.
Dr. Madsky assured me they're treating patients on an individual basis, and they have the patient's best interest at heart. She says high dosages of opioids in the long run can decline your health and even kill you.
And that's what this should be all about, taking care of the patient in the most safely way possible and to provide them the best quality of life. I don't think that's too much to ask. I don't see how we got so far from there in such a short amount of time.
Lauren, Stewart says one day he hopes to live opioid-free, but he just hasn't found the right cure yet.
Yeah, now has Sanford been able to cut the number of opioids prescribed?
So Dr. Madsky told me they were able to cut them by 28 to 30% since 2016, and she emphasizes that that's the goal, putting an end to the crisis.
Very interesting debate. Renee, thank you very much. Well, many states, including North Dakota, have tried to pass the 2016 CDC guidelines as law. House Bill 1063 was an example of this during the 2019 session. Republican Representative George Kaiser was one of the sponsors. He says the bill is specific to North Dakota's workers' comp program. Barring some exclusions like cancer treatment and end-of-life care, the legislation dictates how long patients can be prescribed narcotics at home.
Continuous treatment, long-term treatment on opioids is really the last solution that we should ever want to consider. We want to get people feeling better, back to work, and off of the opioid prescription.
The bill ultimately failed, but Representative Kaiser says the proposal will be back in 2021. The tight timeline